A new year means an opportunity to make positive changes in our lives, so bring out the best natural version of you. Here to show us some of the most popular anti-aging and beauty trends for 2015, dermatologist Dr. Whitney Bowe. Good morning to you, Dr. Bowe.
Good morning. Thank you for having me.
Our pleasure. Is less more when it comes to beauty treatments?
Absolutely. So the aesthetic of looking done with, artificial, frozen, shiny foreheads and overfilled, exaggerated features has thankfully given way to much more subtle and natural enhancement. So 2015 is all about keeping it real. We're looking for the new natural. So the best compliment that you can get as an aesthetic or cosmetic patient is, you just look so well rested. Did you just get back from vacation? Did you get a haircut? You want to leave the observer a bit baffled. You don't want them to be able to put their finger on exactly what it is that you did. So you want to look like you, just the best version of yourself.
Exactly. You don't want to look like you're bloated and, as you said, very oily, and a lot of people look like that on reality TV. Now, what are some non-surgical treatments that will help us look younger but still look like ourselves?
Well, one of the most popular treatments, specifically because it is so natural looking, is something called Dysport. It's a prescription injection for the treatment of the frown lines, those lines between the eyebrows that make you look angry or even tired. And what it does is it smooths out those lines, but it also sort of has a tendency to open up the eyes, just make you look more refreshed, well rested, and the effect lasts up to 4 months. So that's a very popular treatment these days. There's actually a new product that's coming out in about a month or so that's a very natural and subtle product that's the first FDA-approved product for not only the lips, but the lines around the lips, which drive women crazy.
Right.
So we're really excited to have that, and we're not talking duck lips, we're not talking overfilled crazy platypus lips, which sort of represents sort of where we're coming from. This is a whole different type of lip that we're looking.
And you said that's coming out next year?
That's going to be coming out in about a month or so. So stay tuned for that.
Very nice.
Something else that we're doing a lot of is a resurfacing laser that actually has been shown to prevent cancer formation of the skin. So it's a laser that I've been doing in my practice for years, mainly to treat fine lines, to treat sort of uneven tone, texture, pore size. But recent studies show that this specific wavelength, this thulium laser, is actually capable of treating what we as dermatologists recognize as precancers. They're little red patches that can go on to develop into cancer. So people are coming to me and asking for treatments that not only make themselves look better, they want their skin to actually be healthier too.
Exactly. Now, do you find that men are just as concerned about their looks and aging as women are?
They're approaching equality, so I would say about 30% of my cosmetic patients now are men. So men are a lot more proactive about staying on top of their game when it comes to looking their best. I have a lot of my male patients who come to me and they say that, it really gives them an edge when it comes to their career. So they say when they present an idea, say to a boardroom or to a client or a customer, and they personally look tired or they look old, their ideas are perceived as being tired and old. So they need to sort of keep that refreshed, young look so that when they convey those ideas, they're also perceived as fresh and innovative as well. So a lot of men are much more interested in coming to see their dermatologist these days.
And when we go see a dermatologist, what kind of questions should we ask for to make sure we get what we want?
Well, first you want to make sure that the doctor that you're seeing is very well trained. So you want to make sure that it's either a board-certified dermatologist or a board-certified plastic surgeon. The other conversation that you want to have is, you want to make sure that you have the same aesthetic as the doctor. So if you're looking for a very natural, subtle enhancement, you want to make sure that that doctor is on board with that idea. So you want to sort of have that conversation right off the bat so you know what to expect. One of the biggest fears that people have is they're going to walk away and not look like themselves.
Exactly. Well, Dr. Bowe, thank you so much.
My pleasure. Thanks for having me.
Our pleasure. A new year gives us all the opportunity to make changes in our lives, so bring out the best natural version of you. To learn more about simple beauty enhancements, head to the website or right there on your screen.